this is an example of, I suppose, community engagement that I just wanted to feed back, and it was more a labour of love, I think, than a research project, and I think it's still a labour of love. But a number of years ago, together with collaborators in Galway and with an organisation called Autism Speaks, we began to look at the opportunities and possibilities for developing an autism registry in Ireland and potentially also a biobank. Why would we be interested in having a registry? Well, I suppose Jamie has made reference to biocollections. So we were in, registries can provide information on groups of people. So for example, with autistic people, it might be around, diagnosis, pathways to care, and their service use that can help us inform service development and clinical practice. And autism is a lifelong condition, and we've no detailed information systems in Ireland. And this lack of information means that there's poor planning and it limits policy decisions. And we think that better information can inform research around the sorts of supports, therapeutic supports, many of the things that Jamie just referenced right at the end of his talk there, and enhance service development. So for example, there's a very, very well established cystic fibrosis registry in Ireland, and that was instrumental in the development of independent hospital accommodation for people with cystic fibrosis to reduce their infection rates. So, and we know that elsewhere, autism registries have highlighted critical issues facing people, including poor physical health outcomes and environmental risk factors, and poor mental health outcomes, and even more recently, that autistic people might have premature mortality because of a range of factors, including cardiovascular risks, but also really adverse mental health outcomes like suicide. So this is the policy context within which we were operating. There were there was a national review that recommended the establishment of a database, as did a private members bill. But Progressing Disability Services, which is our policy for disability services, is recommending no autism-specific teams currently. And Vision for Change, which is our mental health policy, says that there's no clarity, or really offers us no clarity regarding mental health service provision. And policymakers and healthcare managers often ask me, why do we need specialist services for autism? And they say that we, clinicians, researchers in the community, and the autism community themselves have not been able to articulate strong enough arguments for why that should exist. And yet I think intuitively many of us know that you need to have specialist interventions and services. So going right back to 2013 and 2014, we started a consultation process because we thought, well, there's no point setting up a registry unless we ask the community what they want. So we did a briefing session at a conference in Galway that was led by Geraldine Leader. And we know that there's one national intellectual disability database in Ireland, but this doesn't represent people with autism. And actually people told us that they had concern regarding the potential for misuse of the data, although there's no evidence that that has ever happened. We did a national stakeholder consultation. We did 4 town hall meetings. We set up a stakeholder advisory group, and we did a national online survey. So these were the people who were involved from the organisations. And we got some money from actually a private donation from a member of the Autism Speaks board. So it wasn't from Autism Speaks themselves. And they donated money to, because this was an Irish person, an expat living in the US, to pay for consultation meetings. So registries can ask things like how many autistic people are there in Ireland? Are therapeutic interventions helpful? What factors influence successful school placement? What influences quality of life? How can we plan for life transitions? And what are the mental health and behavioural services needs? We also wanted to ask about whether or not people would support the idea of establishing a biobank, given the sensitivities of having a biobank. So a biobank is, I think Jamie's already covered. We might store samples and use these samples for medical research and sometimes commercialise products of medical research from biobanks. And it makes these large samples available for that might lead towards new therapies, better understanding in our basic research and biomarker research. And in autism, this could help us to identify molecular pathways that might be important for both as inform biomarkers, but also the development of new therapies. But there are important considerations such as privacy, who accesses the data, how is the data protected, how do you consent people, and what the purpose is. And of course, these issues have crystallised even more with the general data protection regulations and the health research regulations in Ireland. So we decided a consultation process was needed to take account of the needs and the perspectives of people with autism and identify, and their families in Ireland, and identify their critical issues, and to give advice regarding what sort of data we should collect. So as I mentioned, we did a stakeholder advisory group, a questionnaire, we had expert panel and roundtable discussions, we did an online survey, and then we produced a document. So there were various members, including Jamie and his mum Dorothy, who very generously participated in the stakeholder group and attended, I think, almost all of our town hall meetings. So we did an online survey, and then this was, as often happens in research about autism and other childhood disorders, this was almost exclusively answered by mums. Well, not almost exclusively, but largely answered by mums of younger people with autism, so children and adolescents. And so that's just showing that they were younger people in the main. We found good support for the establishment of a national registry. A lot of people either strongly agreed or agreed strongly, both for the creation of a biobank and a database. And people indicated in the main that they agreed or strongly agreed with that they were willing to contribute biological samples. So we didn't have money to proceed with a biobank. That's quite a large undertaking. And we actually had no money to make a registry either. So well, these are the problems of research. But, you know, we put an awful lot of work into it. And Sarah Fian, and Matthew O'Sullivan, who were two research assistants in my group at the time, worked very hard as a side project almost to develop, to help me develop a pilot registry. And we decided that we would do it in Kildare, West Wicklow. So we had no money, but we decided we'd do a small unfunded pilot project that maybe would give us data so that we could persuade somebody to give us money. We did a lot of outreach with the health service management and with clinical services locally to support and dissemination about the project, like the information about the project basically. But we went for Kildare West Wicklow because I provide clinical services in that area and I knew the people on the ground well. And we thought in this area, we estimated based on population that maybe we would focus on children and adolescents because it's easier to identify those in the community. There are so many adults with autism who are not identified, or they're in all different kinds of services. So we thought, well, the easiest thing right now might be to focus on the children and the young people. So we thought up to age 18 there should be about 450 to 500 people, and we thought even we could get half of them, that would be great. So we developed a questionnaire, and this was very much involved in patient engagement. Had a patient or a participant engagement component to it. So we developed the questionnaire. We were doing this alongside a needs analysis that we were doing for the Prader-Willi Society. So we were able to use a lot of the development of the questionnaire for the autism community. But we got consultation from clinicians and researchers and parent advocates. And the questionnaire was an informant-based questionnaire to be completed by parents and carers. And we looked at a whole kind of, it was very comprehensive, and that was probably the mistake that we made. We were over-ambitious with the information that we wanted to collect, but we collected information about diagnosis, birth and development, medical and mental health history, behaviours, education, people's adaptive needs, the supports that they were getting through MDT and social supports, grants and allowances, and personal and family impacts. So very briefly, I'll just tell you, so we only got 94 respondents. But I think it was still good pilot data, given that we were doing this in an unfunded way, and it was a pen and paper questionnaire. And again, we had overwhelming response from mums, predominantly. So 90% of the respondents were biological mums, and 87% of the young people or children were males. So we're probably under-ascertained females. And just a few little nuggets of wisdom. So we're still analysing the data, but I thought I'd just show you a little bit of the information. So the majority of people showed there were first concerns about development on average when they were around 30 months. And they first sought help when the child was on average around 40 months. But there was a wide age range, ranging from 3 months right up to 120 months. In terms of development, so about a quarter had motor skills difficulties. Sensory processing was a huge difficulty for almost all of the participants in this survey. So, and in particular, sounds and textures, I think, which will be very familiar to most of you, I think. But actually really, and tastes, but really, you know, very, very common sensory difficulties for people. In terms of medical problems, I think GI problems were one of the most predominant medical complications or comorbidities, and particularly diarrhea and constipation, and then other abdominal pain and reflux to a lesser extent. And of course, not surprisingly, sleep difficulties, and in particular, the classic autistic sleep difficulties that I see all the time, difficulties getting to sleep, sleeping less, and waking up during the night. So in terms of mental health concerns, we saw almost a third of the kids had a mental health diagnosis, and of course these would frequently be overlapping, but not surprisingly the common ones are anxiety disorders down here and ADHD, comorbid ADHD, which is quite common and known to be quite common. And 20% of the children and young people were on medication, and these are psychotropic medications, and a lot of these include second generation antipsychotic medications such as aripiprazole and risperidone being the most common, and then of course methylphenidate for the ADHD. But like this is actually something that I've a huge issue with in general. Because we know that that these medications increase your risks for obesity and cardiovascular risks, and abnormal lipid profiles, and disturb your metabolic function, and potentially, as Jamie says, there may be some subgroups of people with autism who are more at risk for that disturbed metabolism. And we know as well from other research that we've done that obesity rates are higher in people with autism because they're more sedentary and they find it more difficult to get out and to take part in physical activity. And so it's accumulating risks for adverse cardiovascular outcomes. So behaviours then, we looked at things like self-injurious behaviours, which Jamie was talking about in the context of of very severely affected individuals, but actually, self-injurious behaviours are quite frequent even in the people who answered this survey. So things like teeth grinding, affected 47% of people, which may not be so. These are people reporting any self-injury, which may not be quite so serious, other than the fact that you can get a little bit of pain in your jaw from teeth grinding. But things like self-scratching and body hitting and head hitting were affecting a third or more of individuals. And then when we look at aggression, we found that aggressive behaviours towards other people or other maladaptive behaviours were also frequent behaviours. So, 56% of people were maybe hitting other people. And then some of these other highly frequent ones are probably a little bit more, such as non-compliance and difficulty transitioning and OCD behaviours are probably a little bit more related to having autism anyway. But again, behaviours that are quite hard to manage, and I suppose distressing for the person with autism and distressing for the people who are providing care and living with them at home. So we also had a look at family impacts, and this is something, again, just because my clinical contact with families is something I was very aware of. Almost exclusively, people had adjusted, well, not almost exclusively, but a huge number of people had adjusted their working arrangements. Either they gave up work, their partner did, or reduce their working hours to take care of their loved one with autism. And of course, these families, you know, people want to be the one taking, you know, providing that care and support at home. But it shows that financial impact on families is really quite considerable. And we did have some data. I don't probably have breakdowns of the financial data just yet, but we, you know, you can see where people are spending money on therapies and you know, assistive devices at home and so on. And then people reported for themselves that, you know, there was a emotional and physical impacts and financial impacts and impacts on family relationships and their other children. So I suppose what we know from this whole process is that in general, based on the responses we got from the community, a registry and a biobank were considered acceptable. And although our consultation was a little bit more biased towards young parents of younger children and adolescents, and we'd much less engagement in the pilot project than we hoped. Now, some of that was maybe our own resources. Maybe we needed to really be out kind of pounding pavements more than we had enough people to do. But, you know, the interesting thing was that the people who did respond on the questionnaires, they completed every single question. So we had very low levels of missing data, which was good. So they're obviously highly motivated people who are good at completing questionnaires. And we had some really nice comments from people. So one or two comments were things like, nobody has ever asked us so many questions that are so relevant to our lives. So that was really nice feedback. And I guess that we know so far that where it's highlighted, you know, developmental and medical concerns that are in line with what has been highlighted in other registries and large surveys of this nature. Mental health difficulties, aggression, I think, is a big impact on family functioning and on the individual. I mean, we know that that will be a big predictor of why somebody might end up out of school, for example, or not able to access an occupational placement later in life. And also the impacts on a financial, emotional and physical level. So we hope that we can complete the data analysis, and I would like us to present this data to healthcare managers and providers, to advocacy and to the broader community, and publish it as a report and send it in to policymakers and government departments, and hopefully identify funding to develop the project, because I think we probably need to take it online. I think that there could be opportunities for us to link it with some of the activities that are going on in AIMS too. I think we need to do more focus groups and outreach with autistic adults and older adolescents to help us understand what they want, because I don't think their voice has been represented. And I would, for me as a clinician, I'd love to see a longer term study where we could better predict crises and factors that might reduce stress and improve functioning. For people with autism, and then we need to engage now again about translating that kind of knowledge into policy and service development, because there's a real gap for this in Ireland. So that's it. I'm just good. Yeah. So I'm going to finish there and then hand over to Michael.